Hi, everyone. This is Nathalie, Dr. Nats, here to talk about a topic with lawyer extraordinaire Michelle Whitehead about the brand new Victorian Health Complaints Act that took effect February 1st. And it's not really a new act, but it's new in Victoria compared to the rest of the states of Australia. And basically, this applies to all registered and unregistered practitioners involved in health. So registers could be counselors, psychotherapists, doctors, nurses, and unregistered are healers, other types of therapies, homeopaths, naturopaths, massage therapists, etc. So Michelle's going to talk us through why this thing is important, why we need to pay attention, and we'll talk a bit more about that, about other things after that. So over to you, Michelle.
Thank you. So what they've done in Victoria is they've basically done a restructuring of their Health Services Commission, and they've basically just renamed it to be the Health Complaints Commission, and they've given it more teeth. They've given it the ability to actually carry out investigations and deregister or prohibit from practice people who are really practicing in a way that the Commission believes the public need to be protected from. And so that can sound a bit scary, especially given that there is a very broad definition of health service provider. As Nathalie said, it covers everyone who's registered as a health service provider, so all of your doctors and surgeons and physios and all of those, podiatrists and osteopaths and everyone who needs to register. But it also covers a very broad range of unregistered practitioners, and that's all of your holistic healers, all of your massage therapists, your naturopaths, and it can include spiritual and other workers, life coaches, and those. It's really anyone who practices or claims to assist people with their mental, physical, or psychological health. And the other thing to notice is it's not just Victoria, that Victoria's changes are actually bringing it into line with systems that already exist in most of the other Australian states and territories. So pretty much wherever you are, this is something that you need to pick up your ears and listen to, because it's going to give you we're going to try and give you some really practical information today about how to make sure that you are protected and you never get into trouble with any of these commissions.
Mm. Yes. So Michelle's going to, I think, share the screen. She has lots of documents open.
So the first one I will share with you is just the article. Hang on, lost my Zoom buttons. They're down too low. Here we are.
Oh.
There we go. So this is just the article about the watchdog, the new watchdog that they're calling it for Victoria, the Health Complaints Commissioner.
What a scary name. Watchdog.
What's that? Watchdog.
Yeah.
Watchdog with teeth.
Why not puppy?
Yeah. Well, it makes it sound very vicious and aggressive.
Threatening.
And when you actually read the Act and when you actually read into the philosophy surrounding it, its purpose is not to go out and hunt down practitioners. Its purpose is to protect consumers.
So isn't this a nice... sorry.
No, go ahead.
Well, it's a nice kind of message about don't just trust, the media to give you all the information. Follow up and go to the source. So talking about this Health Act, then go and investigate what this Act is about from the source. Its function,
the function of the commissions are protection. Although they have prosecution powers, their main function is protection, and they can only act really where a complaint has been made. And complaints can be made by patients, by carers of patients, and by people on behalf of patients. So that's just that one, and then we're going to just pop in here. If you're looking for the Complaints Commissioner in your state or territory, the Tasmanian Commission, so this is Health Complaints Tasmania, healthcomplaints.tas.gov.au. They have a useful page here that links to all of the others. Or you can just Google Health Services Commission in your state or territory, and you will find the place. It will pop up. And all of them have an About Us. They've got this how to make a complaint section with the complaints process. And most of them have a section of information for providers. This is the actual Victorian Health Services Commission page. It has a lot of information. It also refers here, this is what's actually caused the change in Victoria. And that is that there's a national code of conduct that's been developed, and various states and territories are now implementing this code of conduct by bringing it into their home legislation. So, for example, the National Code of Conduct sets a standard for non-registered providers because they're outside the national scheme regulated by AFRA. It also applies to registered practitioners who are operating outside their area of registration. For example, a physiotherapist when they're providing Reiki therapy.
Reiki, yep.
And Reiki. And any breach of this code then becomes the sort of thing that could cause a complaint. So you really need to be aware of what this code of conduct is, wherever you are in Australia, even if you're in a place where it hasn't been implemented yet. Because if you align your practices with this code and you personally make a commitment to voluntarily comply by the code, then when it is implemented in your state or territory, you're already going to be covered. You're going to be using this as second nature. So you just make the terms of this code part of your modus of operation, part of the way you practice, and you won't have any trouble. So, for example, the elements of the code are that practitioners provide their services in a safe and ethical manner, that they obtain informed consent from their clients. So you give really transparent, really clear explanations of what you're doing and what the options are, and you get their consent.
And ethics, an ethical manner. I think that's a whole minefield of stuff, because how do we know it's ethical? Because it applies, different rules for different people, different contexts. So I think for me personally, having mentoring to really explore what I've done or what I've said, or, a path that has been taken in the work that I've done with someone, to really look at what else could be done, what could be done in the future, really explore your decisions and the decision making of you two together in the reflective practice or supervision. They're there to help you with this idea of ethics and doing, right action and harmlessness, because that's what we're about. Benefit without any harm.
Yeah, exactly. So obtaining consent, we've done. Displaying appropriate conduct when giving treatment advice. So once again, that's another fuzzy grey area. What is appropriate conduct? Yeah. So that might be an area where you could gather together with a group of your peers, with colleagues, and with other people practicing in the same modality as you, and just have a group meeting and have a discussion. Okay, what is appropriate conduct? And that way you get outside influences, but you also get to make your own, explore your own perceptions of what is appropriate in your conduct with clients, and set your own boundaries.
That's right. And so peer mentoring is important.
Once you set your boundaries, stick with them. This is an interesting one. Report concerns about treatment or care provided by other care workers. So it is a part of the code that we keep an eye on each other too, but it's not in that sort of dobbing each other in thing. It's really a bit like mandatory reporting of child abuse, the way I see it.
Yeah. Well, if you see your colleague is having not the greatest time, you're going to want to find out, are they okay? And, be a caring individual and support them, or refer to someone who could support them. But that's the thing. That's why supervision is important, so that there's someone looking out for you to ensure that you're not going down a rabbit hole of something that you are not aware of. So,
when you see someone else who is practicing in a way that you believe is completely unreasonable, not to turn a blind eye to that, but to really think about how that could be impacting clients, and make some inquiries. Taking appropriate action in response to adverse events. That basically means when something goes wrong, don't try and bury it. Really. Don't try and cover it up. Don't try to
fix it if it's out of your depth. Always refer onward. So if you have clients who pose a suicide risk and you haven't had suicide training, then you really need to be referring onward. Or anything critical that is you're out of your depth, we could try to either avoid it, like pretend it's not there, or we try to fix, but it's the best thing to just refer onward. Or train up so that you can manage those things too. Professional
the next
development.
Two about infection control, to adopt standard precautions for infection control and to practice safely if diagnosed with infectious medical conditions. So that's just about basic client care, and it's mainly going to apply more to the more traditional medical practitioners, but I'm sure there are, and it's not going to apply much at all to those of us who practice entirely on Zoom and never leave the comfort of our own home office.
Unless it's a computer virus.
It's a computer virus. Yes, we need to practice appropriate precautions.
Yes.
Exactly. Very much so.
Quarantine. Yeah.
Not make claims to cure certain serious illnesses. So this comes back to consumer protection law and the truth in advertising provisions that come from that. And really, to not say that you can cure cancer, or to realise that if you are claiming to be able to cure cancer in 3 weeks, that you better be able to put your money where your mouth is.
Have a lot of evidence to back that up. Yeah,
you're going to need to have a really solid, peer-tested proof behind you before you make that claim. So it's just you've got to make sure that the claims that you're making in your advertising are realistic and reasonable. There's what's called puffery, which is a claim that's so outrageous that no one could possibly believe you're speaking the truth. That crosses the line. Puffery is okay, but anything less than puffery, where you sort of saying something that you are a miracle worker, like I say with my kids, yeah, sure, I'll just wave my magic wand and you'll be fixed immediately. That's puffery. They understand that that's puffery. If I start saying, oh yes, well, if you take these, if you do this, 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 and this, take this, drink this, eat this, you'll feel better. Then I'm sort of starting to make a claim. And luckily, it's never been in relation to a serious illness. And it's only certain serious illnesses, so you might want to have a look into the code and see exactly what illnesses that it refers to. But it's going to be the really, really life-threatening, life-changing ones.
Yeah.
Not to misinform their clients. So you just need to be really transparent. And that's where your client agreements really, and your disclaimers in your client agreements really come to the fore. And your website terms and conditions, all those website legals. That's really the purpose of website legals, client agreements. It's a main core purpose of them, is to put that information out there really transparently so that people know exactly what it is you do, how you work, what they can expect from you, what their responsibilities in the situation are, how far your claims go and where your claims stop.
And what you don't do.
Yeah, exactly. What you do and what you don't do. Yeah. And this is the spot where people who, for example, are a psychic or a life coach or a spiritual worker who do not work with physical, mental, or emotional health as such, can protect themselves, because in their disclaimer, they need to put in really clearly, I do not claim to fix your physical, mental, or psychological health. I do this instead. I just give you tools to help your daily flow of life or whatever. And And if you have any concerns about your physical health or mental health or your psychological health, you need to go and see an appropriate professional.
Yeah.
And those kind of disclaimers
And
are what...
this is not an alternative to your
That's right. Yeah.
seeing your doctor and all that stuff.
Yeah. This is not medical treatment. It's not a substitute for medical treatment. Yeah, all of that sort of stuff needs to go in your disclaimers very, very clearly. And that's where how you handle the misinforming of clients. And also just to talk to them, to explain, to have a welcome pack, all those sorts of things. The more information you provide them, the more accurate information you provide them, the better you're going to be covering yourself.
And checking in with them verbally what they understood. So not everyone receives information, especially if, the pile is this thick or even 2 pages. We know how lazy we are with reading Facebook posts. So we always have to check in verbally that they understood. Sometimes we might want to get them to sign. I don't know. So there's just different ways that we know that they know that we know that they know.
Yeah. The more different ways you present the same information to, as well as checking in with them, the more chance there is that they're going to it's going to sink in.
Right.
Not to practice under the influence of alcohol or drugs. Well, that's pretty much a no-brainer, really. To modify or stop practicing if they have certain mental or physical impairments. So this basically means there's been all sorts of claims in the legal field, for example, where lawyers have kept going after they've got to a point of stress where they can no longer really do their job. This could include things like Nathalie's specialty of compassion fatigue. It could be any of these areas where you get to a certain point where you can no longer really responsibly do your job. You have to be aware of that. And that, that's part of providing your services in a safe and ethical manner too. It comes back to that.
Because it's not about us as practitioners. It's that we're here in service to our clients. And if we can't be as invested as possible in benefiting them, and that we pose a risk of harming them and ourselves in the process, then we need to just check ourselves out for a little bit. And it's okay to do that.
Yeah, exactly. Not to financially exploit clients. That's another tricky one. What does financial exploitation mean in this situation?
Yes.
From a legal point of view, it means not mortgaging their house, not abusing the trust that they place in you.
Yeah,
but it's also
some treatment for some illness that, it's questionable. Yeah.
When they come in to see you for a splinter in their finger, you don't offer to amputate their arm. That could be outselling your products. I love them. Arguments ad certain. Not engaging in sexual misconduct. So once again, having those boundaries around what's appropriate professional behaviour and what's not. Complying with the relevant privacy laws. This is a big one. A lot of people don't have a privacy policy that's written up, and they don't have it on their website. But even if you don't have a website, you need to have a privacy policy. And a privacy policy is compulsory for every health service provider under this huge definition. And that's just where this huge definition originally came from. It came in, it was first introduced in the privacy policy in the Australian Privacy Principles. Now, a privacy policy basically says that people are trusting you with their sensitive information. So their name, their date of birth, their address, their contact information. But they're also entrusting you as a health provider with what is really seriously sensitive information about their life, their well-being, their information that they wouldn't share with anybody else. And you need to have a policy for how you're going to deal with it. Where are you storing it? If you're storing it online, are you storing it in the cloud? Do you know where your service provider is based? Do you know what their terms of use are? Do you know what their security policies are? If you're storing it written, are you storing it in a locked filing cabinet? Or who has access to those written records of yours? If you're using email and things like that, are your clients aware that the information that they're transferring via email could be intercepted.
Yeah.
Once again, it comes down to clear information, providing clear information about what you do and what you don't do and how you're going to do it, and then sticking with that information and actually complying with your own policy.
Yeah.
It's just absolutely basic risk management, really.
Yeah. It's confidentiality, and it's part of
all the confidentiality.
ensuring that you have a trusting relationship, because you can't really do good work when trust isn't fully there.
Yeah,
so
absolutely.
You want to make it easy for yourself to benefit the person you're working with.
Yeah. But in this online world, there's also more risks than there would have been in the past too. There's also all the phishing and the identity theft and things like that.
Yeah.
And you just have to keep that in mind and remember that it's not just your information that you're responsible for, that you have a responsibility to keep their information safe when they trust you with it.
Yeah. Even sharing results of your clients on, in Facebook groups, that, that's questionable. Like, just naming people who have seen you.
Oh, no, never name them.
That's not
confidential. Appropriately anonymized sharing can be okay if all identifying factors are removed.
Yeah.
Or if a person explicitly gives you permission. For example, if you request a testimonial and you ask in your request, do you mind if I identify you as someone who has worked with me and use your testimonial words in my advertising in these forums? Then it's okay. So long as you've got their informed consent again.
Yeah. And some people might have, rapid breathing and, pulses going quickly, racing, hearing all this stuff. It's like, oh my God, I don't have this. I need that. This is all good, because there are ways to get all this stuff. You don't have to pay a lot of money to put all these things in place, and you'll feel better. It's probably the elephant that's been in your clinic or in your practice for a while, and just like get it out, put the stuff down, and then you don't have to worry about it.
Yeah. Once you've gone through this and you've actually looked at them clearly, they're no longer that hidden dragon in the cave of your subconscious waiting to come out and maybe attack you one day.
Yeah.
You've
helped me a lot with that.
You've looked at them. You've brought it out, you've looked at it, and you've decided, okay, I can do things about this. I can make this safer for my clients by just putting a few simple policies in place. And it doesn't have to be all legally written up. That's a good thing to do. But if you're not at that stage yet, then even just writing up something yourself, thinking, this is what I'm required to do. How am I going to address this? How does this work in my practice? Don't approach it from a place of fear and avoidance. Don't think, oh no, they're coming for me. How am I going to protect my ass? Think, I love my business. I'm really curious about how I can do the best for my clients. This is, okay, let's look at this. How can I implement this that would really be self-care for my business and extra care for my clients, and give them make sure I'm giving them the best possible service?
Yeah, we can consider this professional self-care. How am I looking after my professional self? In addition to my, physical, mental, emotional, spiritual, whatever self. Yeah. Great.
So keeping appropriate records.
So I think a lot of unregistered practices and therapies might not have gone through training in record keeping. So, again, you could find all this stuff online. It'd be a good idea to just how to take clinical notes. It doesn't have to be this massive thing, but just something that you add in. That's, again, better for you to keep records.
To just educate yourself about, what's best practice in the area.
Yeah, because a client might come back and say, that session we had, I wanted to remember something. And if you had verbally said at some stage, you can access that, and you don't have good records for that, then we have a bit of a conflict. So,
And then that jumps back into your privacy policy. So you've got to, once again, store those records appropriately. Be covered by appropriate insurance. If you don't know what's appropriate, put out some calls in your group. Put out calls to people who are similar to you. Talk to someone who, even if that you might see them as a competitor or something, reach out to them and say, hey, look, I'm really not sure about this, and I wondered what you thought. What insurance do you have? Do you have any ideas around this? I'm all for connection, and I think that every time I've reached out and connected with someone, I've been absolutely blown away by how positive the experience has been.
So true.
And things like insurance, they're things that everybody finds scary.
Yeah.
So, yeah.
And they're not big costs considering, what you get covered by. Because, I put that expression on my post, trust in God, but tie up your camel or tie up your horse. You don't know what you don't know. So there's always a risk management proportion for work. So let's just do it.
Like carrying an umbrella on a rainy day.
Yeah. Or living in Melbourne and carrying every bit of your wardrobe for whatever, whatever weather decides to happen. Yeah.
You plan for the conditions. So you
spare tires in your boot, that sort of thing.
You've chosen to work in the health service industries and or the alternative health service industries too. And then this is part of it. Yeah. And it doesn't just protect you. It protects your client too, because if something does go, think worst case scenario for a second. If something did go horrendously wrong and your client is seriously injured or needs serious treatment that is very, very expensive, and she can't afford it and you can't afford it, the only person who's going to be able to pay for that treatment and look after your client is the insurance company. And that's the thing that that's why I do it.
I do it. Yeah. Well, it's part of my own registration as well within my own
exactly. As a lawyer, I'm not allowed to practice without it. So there are lots of us out here who don't get a choice. Yeah. If you're one of those people who does have a choice, just realise that this code of conduct says you no longer have a choice. You need to think seriously about insurance.
Let's think about, you need to do it, I think.
Yeah, basically. Yeah. Well, if someone makes a complaint about you and you don't have insurance, then the commissioner is going to be able to investigate you. Yeah. So that's sort of something to bear in mind.
All right. But it's not going to happen, but it's good to have it.
It's not going to happen. It's just good to have it. Yeah. And finally, displaying the information about this code and how to make a complaint. That's an interesting one. So that kind of suggests that you should pop a copy of the code in your welcome pack or a link to it on your website somewhere.
Yes.
If you're working online, if you're in a clinic, have one printed out, set on the receptionist's desk. That's all it requires, but just to have one there. And there's some here.
They tell you what to put in. A copy of
the code is here, right here on the Victorian site, hcc.vic.gov.au on the healthcare providers. So if you look up here, it's non-registered providers. There's a link up here for healthcare providers. Then the non-registered providers go straight to the bottom, and you've got the full text of the code of conduct, the code of conduct in brief, or you've got this one, which is
poster you can display.
Ethical healthcare. A nice, safe poster you can display.
Wow.
And note this, see, it's okay to raise your concerns with a health service provider if you're not satisfied. So that's the last thing I really wanted to say was that you need to have a really, really robust complaints policy. You need to encourage people to come to you first if they have a problem with anything, any aspect of your service. Yeah. And you need to have a policy in place for how you're going to take their complaints seriously, how you're going to let them feel listened to, and what you're going to do about it. And that brings us into the other project that Nathalie and I are doing, which is a mediation service. We're both accredited mediators. And mediation can be an awesome way to deal with something if people have got a complaint. But it's not necessary. You could just negotiate with your clients. You could have a superior that they could go and speak to if they're not happy with your response. Yeah. The more robust, the stronger your complaints policy is that you've got built in, the less chance there is of anyone going beyond your policy and out to the Health Service Commissioner. Yeah. If you contain that complaint within your business and deal with it appropriately and respectfully and responsibly within your business, then it doesn't blow out and you don't have to worry about all of this stuff ever actually going wrong.
Yeah. Great. Just have it in writing. Encourage feedback so you know where you're at.
Yeah.
Always talk to your clients. How are we going together? What can we do differently? And, you know, let's keep that conversation going in a non-dependency kind of way, just so that you can gauge that, are we going well together? Is this effective for you? And so complaints don't come out of the blue. And if they do, then it's just a negotiation, a conversation, and that knowing that there are other, you know, peaceful ways of resolving conflict before it needs to be raised at a higher level. And so we're definitely encouraging that. Yay.
Exactly.
So, and
and the other thing was to say too, that the healthcare commissions, they don't just take you straight to court. They're conciliators too. So if there is a complaint that does go to healthcare commission, then what the commissioner does is he encourages, or he or she encourages you and the client to negotiate and to try and work it out between yourselves.
Yeah.
So there's level after level of trying to look for a win-win solution in this stuff before it gets before it gets to that prosecution and prohibition stage. That prosecution and prohibition stage is only going to catch the worst offenders, and that, to be honest, that's what we all want it to be there for. We want it to catch the people who really are truly unconscionable charlatans who shouldn't be messing with anybody's health. And unfortunately there are one or two out there occasionally.
But isn't it good? It feels good to know that I've covered all my bases, plus ethical practice, plus doing my best to align with the code of conduct written out, but is also hopefully similar to any registered body, where I'm doing the things that, say, psychotherapists are required or nurses are required, you know, to the degree that I can for my own therapeutic modality. So the more we could do that and align ourselves with a desire to grow professionally and evolve our practice and constantly learn from our experiences with our clients from a place of curiosity and humility, and I just want to be a better practitioner, better and better all the time, then you're going to be on the right track. So those are my thoughts and opinions.
Absolutely. Yeah.
So I think that's everything. I think that's pretty thorough.
If anything's confusing, and the last thing is, if anything is scary or confusing or really worrying for you, reach out to someone. Reach out to a more experienced practitioner. Reach out to someone who's experienced in reading legislation and knows what it says. Reach out to someone who is experienced in ethics in your area. Reach out.
That's
educate yourself.
And there's a group on Facebook called Master Your Energy, which is there for practitioners of any modality, registered, unregistered, to ask questions that they're not sure about, or, you know, your questions concern de-identified. We're there to support each other, to be the best practitioners we can, and to clear up our own kind of confusion about things in a supportive environment. So I encourage people to have a look at that as well. It's not a business networking site. It's just a mentoring support site.
And similarly, there's my group's the Business Serenity Group, and that's the same thing for law. If you've got any legal question, any consideration about boundaries or contracts or anything anything that's worrying you, it's just a place to ask questions.
Yay!
Share knowledge.
Share knowledge and be confident practitioners.
Absolutely.
Great. Yay. Thank you, everyone, for tuning in, and spread this around. Spread it around to anyone you think it's going to be helpful for. Blessings, everyone.
Bye.